Paid for by True Heights Treatment. Understanding Mental Health Diagnoses, DSM-5-TR versus Psychodynamic Diagnostic Manual-2, PDM-2. When you begin therapy, especially at a practice like True Heights Treatment, you might hear your therapist refer to tools like the DSM-5-TR or the PDM-2 to understand your emotional and mental health challenges. While these might sound like jargon, knowing the difference between these two major diagnostic systems can help you feel more informed and empowered in your healing journey. What is the DSM-5-TR? The DSM-5-TR, short for the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, is published by the American Psychiatric Association. It's the most commonly used manual for diagnosing mental health disorders in the US. Key features of the DSM-5-TR focus on symptoms. It identifies mental health conditions by outlining specific symptoms. For example, to diagnose major depressive disorder, a person must have at least 5 symptoms, like sadness, fatigue, changes in sleep for at least 2 weeks. Checklist approach. It operates much like a checklist. If you meet the criteria, a diagnosis is given. Used for insurance and treatment planning. Most insurance companies require a DSM diagnosis for reimbursement, and it's a standard tool across many treatment settings. Why it matters for you. If you're seeking therapy, especially if it's covered by insurance, your provider will likely use the DSM-5-TR to provide a formal diagnosis and guide your initial treatment plan. What is the Psychodynamic Diagnostic Manual, PDM-2? The PDM-2, or Psychodynamic Diagnostic Manual, 2nd edition, offers a more in-depth look at a person's inner emotional life. It doesn't just ask what symptoms you have, it asks why you have them and how your unique personality and emotional world play a role. Key features of the PDM-2, emphasis on the whole person. Rather than labeling a person based only on symptoms, the PDM-2 explores personality style, emotional patterns, and unconscious processes. Looks at long-term patterns. It considers your life story, relationships, and how you experience yourself and others. Used in depth-oriented therapy. It's a favorite among psychodynamic and relational therapists who want to explore the root causes of distress. Why it matters for you. If you're interested in exploring your deeper emotional patterns, past relationships, or long-term personality traits, a therapist using the PDM-2 may help you get to the heart of what's going on, not just the surface symptoms.